Amy Sanders Bekanich, and today we are going to talk about abdominoplasties and weight loss with subsequent abdominoplasties. And I am joined by my fantastic consultant, Letty, who is going to help us field questions and who will also help us with any interest in consultations and be able to kind of describe that process of how to get an appointment if you so choose. Okay, so please don't hold back. This is your time to ask anything that comes to your mind. All questions are important. They're not redundant. It's always better to get it from someone in an interactive situation like this. Okay. All right. Are we good, Letty?
Yes,
I'm
we're
going to share
good.
my screen. All
Yeah.
right.
And welcome everyone. It's good to see some familiar names on the participants. So it's good to see everyone and we're going to have a good time here.
Here, this one. There we go. All right. Sharing my screen. Okay. So we all know the date today. It's the day before the big freeze, right? Hopefully not. Um, okay, Allison. I'm trying to go down. There we go. Okay. So what is an abdominoplasty? So we're here to talk about body contouring today and taking off essentially skin of the abdomen, and doing some element of work with the muscles underneath that. And the big picture word is abdominoplasty that we all throw out there, but it actually takes on a lot of different meanings. The general idea, though, which I'll describe now, is an incision. Almost always it's at the bottom portion of the abdomen. Variable lengths depending upon how much skin and how much work you need. So everybody's different. Also typically involves an incision around the belly button. That way things can be moved and pulled down and made nice and tight. We remove skin. We remove stretch marks that come with the skin. Fat can also be removed that is with the skin, or even fat around if we add on liposuction to it. You can take that incision and go all the way around the body, and it turns into a body lift, which is more meaningful for patients who have had significant weight loss. But with just a traditional abdominoplasty, it's just in the front. We also, when we're doing this surgery, we can see the muscles that are there. So you have two rectus muscles on each side of the belly button. And when we have had some sort of pressure on the inside that has the abdomen get pushed out, those muscles get kind of split, or they even just get softened. And when we're doing the tummy tucks, when we've lifted everything up, we can actually see those muscles. We can see the split. You can even do that when I'm doing um, a consultation. You can actually feel where that split is. So when we're doing a tummy tuck, we have access to those muscles, which you can't get when you're doing liposuction or other procedures that don't actually get in there. Those muscles can then be reconstructed so that they are then bridging that gap, giving you a tight core, and really changing the entire silhouette of your body. We also do some treatment around the belly button. There's a misconception out there that the belly button is new. It is not necessarily new. It is attached to you. However, the skin around it gets changed. Often looks like takes up some of that softness that's around the belly button. So it kind of looks like a new belly button. You can, depending upon the way you decide to place it within its new area around it, it can have a different kind of shape. Every surgeon has their own technique of what they think looks good. Oftentimes, I'd say to you, if you really have a particular shape that you like, you can go in and ask your surgeon about that. So you do get to do some changes to the belly button. We do, like I mentioned before, tailor things with liposuction. You can do liposuction just on the sides, but I think for a lot of patients and a lot of the patients that you'll see in the pictures, I can do liposuction in a lot of the areas. And so it's not just skin removal, it's really thinning things out and just creating a whole new look. It's great. All right. Who is a candidate? Typically what we're looking for is the abdomen soft? Do you have flexibility for removal? So patients who I see in the office, they have softness to the skin that can be kind of pulled down. They have some excess fat. They have stretch marks that they want removed. The muscles, when split, like we've talked about before, or stretched out. Um, when we're thinking about the muscle, again, split, it's not just that you can kind of feel it separated, it literally changes the way that the belly looks. So the belly looks kind of full. Oftentimes, patients will say, geez, I get bloated and I kind of look like I'm 3 months pregnant sometimes, and I'm not. And a lot of that has to do with the fact that those muscles are split. So when you have an abdominoplasty and we can reconstruct those muscles together, that can change that. And the really fun thing about this surgery that I like is that that is what can change this. So liposuction is great. It has its place, but if that is something that bothers you, this is what we have to do. Also, who is a candidate? Someone who just doesn't like the way that their abdomen is shaped. Someone can have kind of more of a blocky consistency with a little bit of excess on the sides and softness. And so we can actually even just kind of change and give you more of an hourglass shape. You need to preferably, ideally, be at your goal weight. That's where a lot of these weight loss drugs have really changed the name of the game for us. Before, I would have a patient come in and I would say, potentially, if they still had a lot of thickness, okay, this is your goal, because you want to get to the best result that you want. You don't want to go through the surgery, then lose more weight and then have softness to the belly. So we want you to have the best result for you as well. Um, but in the past, I would have to say, well, we could do liposuction before, which of course always is an option. Or you could do diet and exercise regular way. But we also have these new great drugs that can allow for weight loss that can be in combination with your whole transformation that you want for yourself. And it can get us from point A to point B quite faster. So it's been really fun to see that. I've seen a lot of patients come in, they've been on these medications, and their abdomen is just really now in the best possible shape that we can do a lot with making the contours different. Um, One important thing for a tummy tuck versus some other procedures is that you just really want to make sure that you have the time for recovery. So when the skin and such are taken off, we want to get you the most that we can, right? So when everything is softened, that you still have a nice, tight, flat abdomen. So when the surgery is performed, we put you in a sitting position and trim everything off, which means that afterwards you have to not put a lot of strain on that incision and requires you to be kind of bent over and sitting in a certain position, laying in a certain position, walking in a certain position. So you need to kind of make sure that your world's going to allow for that. Give yourself a little bit of time off from work. Make sure you don't have any really big holidays or super important things like your kids getting graduated or you have to go to a wedding in 3 weeks. You want to take all that time and energy that you need to use for healing to put into you. So that's something I very much emphasize to all patients. Um, your medical health. So if there's something going on with you, take care of that. Be in the most optimal shape. Again, so you can put all of that energy for your healing and recovery into you. And that way you'll get the best result. So we'll talk about that in the consultations. I'll go over all of that with you. If there's any question, we kind of touch base with your medical professional for your primary care and make sure that you're optimized. I always get labs and just always do a double checks and balances on making sure that you're in a healthy position to do this. Realistic expectations. That's kind of a term that's thrown out there more that it's really all this is tailored to you, so that goes into the conversation that we have back and forth in the consultation process because I want you to get the result the result that you are looking for. Um, and so showing me pictures that the that's really going to make all the difference for us. It also means that it's not taking the fullness from the front, also making sure that the sides are nice and tight and the back is nice and tight. Then we need to doing the whole circumferential lift that comes along with we see in patients. You can't not having a trend on this slide. It's not an absence, but I would have to say that it's in your best interest to do the surgery once you've had your kiddos. Um, Again, it doesn't preclude being able to have children, but things will stretch again. I mean, any woman who's had a child sees that changes to the body do happen with every kiddo. And the time to take off work is relatively meaningful for everyone. And there's only so much you could do that because you want to take vacations and things like that. So just kind of again planning that what fits with your style and thinking about it ahead of time. Okay. Who is not a candidate? Um, so in the past, so I've had this on the slide before, extensive excess fat and or not skin, but extensive excess fat. I feel like with my results, I have really, on a lot of patients, been able to thin out with liposuction in conjunction with the abdominoplasty, and it looks great, and their healing has been great. And I think that's just with experience and technique. And so you're going to see that on some of the patients. So that used to be more of a contraindication for me, meaning a let's wait and see and have you lose weight kind of thing. But you're going to see with some of these patients pictures that they look great. And it's not that they were little skinny with loose skin only. They had varying amounts of thickness to them and such. Um, the one thing that really I can't do anything about is something called intra-abdominal fat. So we as people hold on to areas of fat pockets in different places. Everybody's different. As we age, women have a tendency to gain it in the abdomen. Patients will come in, we'll have conversations, and oftentimes they'll communicate, oh, an area always stays large, no matter how much weight I gain. Well, one in particular area, particularly as we get older, is we start to accumulate fat beneath the muscle, like behind everything I actually have access to. Um, and that's the intra-abdominal fat. And so you can't liposuction there. That is all weight loss drugs or diet and lifestyle. And the reason why this is important is that it contributes to the shape of your belly, and the tummy tuck is not going to affect that portion. So when you come in for a consultation, I'll be very frank with you about whether or not that's a component that's affecting your particular case. Oftentimes I see that more with men, but occasionally with women. So if there's too much fullness there that I can't get to, but that's your goal, then we'll talk about that and try to strategize some options for how to reduce that. Medical health needs that need to be addressed, high blood pressure, diabetes. So there are certain criteria that we're looking for to make sure that you have a healthy and safe surgery. And then again, the planning to have other kids in the future. I will always bring that up and just make sure that it's not going to be next year, etc. Okay. All right, so what is this procedure? As you can see from the pictures, the incision is always low on the abdomen. It can be varying heights depending upon sometimes just surgical technique, but typically we try to keep it low. Underwear and bikini styles have gone lower and lower. with time. And so we try to keep things so that they can be hidden because you're going to go through the surgery and we want your belly button to look fantastic. We want your contours to look fantastic. And ideally, I want you to be able to wear a bikini and feel really fantastic about yourself. So with this picture that you can see, just basics, incision down low, that's on the very far left of the screen. We go down, we can expose those muscles that you can see there. Those muscles are then reconstructed in towards the center, and that's what gives us that flat abdomen. Liposuction alone cannot do that. Then I put you in that bent position, like I mentioned, and everything is pulled down, trimmed off, and you end up with your scar on that lower part of your belly and then around the belly button. The lower picture shows just a kind of typical marking. Everything in plastic surgery is about marking. So when you come in for your surgery day, they have you stand up, measurements are out, et cetera, et cetera. And we are trying to make everything as symmetric as we can. And this is a really good example of a marking. Most of the time, we're trying to get that skin that's right above the belly button, bring that down, and just eliminate all that softness. Um, and you can see even on this patient, that's really low down there. And if she had a C-section scar, it's going to take all of that away as well. So you don't end up with two scars if you have a C-section. It just completely takes it out. The incision is closed with 3 layers. And then for at least for me, some people use glue. There's different, every surgeon has their own preference. But I like to use a nice tape that goes across. I think there is excellent healing with that. You wear a binder afterwards to help bring in the contours. It helps decrease fluid. You have a couple drains. Um, Everyone has varying degrees of how long the drains stay in. I think it's probably it sounds funny, like a drain. That sounds like a really weird thing to have. But I always say the analogy is when you're a kid and you skin your knee, you kind of have that fluid that is there afterwards. That's what your body does on the inside as well. And we don't want that to accumulate. And so drains are there to kind of remove that while the swelling's going down. And then they come out. Usually within the first week is the first one, and the second week is the second one. With regards to weight loss patients, those drains have a tendency to stay in a little bit longer just because there's a lot more vasculature there, the lymphatics and such. But you keep a little log of how much is coming out, and your body dictates when we remove those. But I don't think they're as terrible as it sounds, but you do feel better when they come out.
I do have a couple of questions when you're ready that are kind of
Yes, sure, of course.
Okay.
Interesting.
So one patient is saying that they lost 100 pounds in the past 18 months or so. They're down to 10% body fat. So
Mm,
the skin is literally just deflated with no fat beneath. Is fat
yes.
content required?
No. No. Um, When I'm thinking about really thin, thin, thin skin, the trick with that is that we don't want it to be so tight that it stretches if the skin is thin, because then your scar will get a little wide. So we can actually, as surgeons, when we're in there and doing our stitches, and it's all individual stitches, it's like hundreds of stitches, so that's why it takes a little while, can feel the thickness of how that's going to stay there. And so actually our repair is gauged on that. So for the person who's asking that question, you can have a wonderful result. It just really kind of depends on that thickness of the dermis. Will determine kind of how we go about with your surgery. But I've done a lot of patients who are thin like that, and you can get a beautiful result, of course. It's almost better than having a lot of fullness there, for sure.
Okay. The next one, how long is the recovery? I know that's a loaded question. The patient stated that they missed it if you had stated it.
No, it's a little bit later. The grand idea is 6 weeks. We kind of say that for almost everything, really, in plastic surgery for breast and body. But it depends on your healing. 1 month with no work. If you're having any incision struggles, which ideally you aren't, and that's when we're starting to let you start to move on with exercise. Recovery is a funny term in a way, right? So for one person, what is recovery? Recovery to them is I can go swimming, I can do sit-ups, I can skydive. That's recovery. For another person, recovery is I can just go to work. And so that kind of is a conversation that we have. What is recovery to you? But you should be doing regular activities, not doing crunches. I really personally don't like people to start doing crunches until 6 months because I don't want that repair to be compromised whatsoever. The one on the muscle, one you can't really get to as well afterwards. Um, but 6 weeks is just our general swellings going down. You're feeling so much better and doing things.
All
Okay.
right, next one. What if you're, I think you already answered this. What if you are not the ideal weight?
Mhm. Yeah. Depends what ideal weight is for you and depends where you're holding that weight. Um, so there's kind of a lot of factors that go into that. If your BMI is 35, probably, we're gonna have a conversation about that. But if it's all in your hips, that doesn't matter. It just depends on where it is on your belly. Again, I can thin things out with liposuction and get a really beautiful result. And so that can take away some of that non-ideal weight part, but it's really just you individualized, but it's not an absolute no for that.
How long after having a baby can you have the surgery?
I think it's good to wait at least 6 months because you want to spend money and have it worth your while and not have things get soft afterwards. So, number one, you have a new baby and you're having to take care of that. It's a lot of strain on your body, a lot of late nights. A lot of late nights create a lot of swelling in your body, just even total. Your body's gone through a lot and you want everything to kind of settle. Same thing with the breasts, really. Everything to settle so that we are taking off as much as possible so that you have the great result that you get long term.
And if a patient has a C-section scar, would you use the same incision?
Almost like 99.9% of the time, yes. Hmm. Yes. They're getting lower and lower, it feels like, but yes, we do. Hmm.
Okay, perfect. So that's all I have for now. So I'm sorry
No,
to interrupt, but let's continue on.
you're fine.
Yes.
Okay. So this is a picture of varying incisions. The typical one that I think I use are the two in the center. Most surgeons like to keep it low where that C-section is. A lot of people get C-sections nowadays, and so we would like to incorporate that scar with the removal. And then it is flared on the sides depending upon where your skin laxity is, how your hips are, because everyone's shape is a little bit different. I did work, Sonny, I worked with one surgeon who always would do the one on the right, very high up. You can get a beautiful result with that, but it does then limit what you can wear in terms of avoiding someone seeing the scar with underwear or with a bikini. So I steer away from that one. Plus if they have a C-section, then you can't remove it. So typically the lower one that you see on the screen, but they're varying flares at the end depending upon what needs to be taken off for you. The picture on the bottom, this illustrates something important for patients because some patients will have fullness, decreased weight, skin laxity, and it's all low. That's a traditional tuck. We take off what some patients will have weight loss, decreased fullness, but they still have the skin above the belly button. When that's the case, if you just do a traditional tummy, your softness above your belly button just gets transferred to the lower part of your belly. I really don't get to where you want to be. So that's where we have to do something called a fleur de abdominoplasty. And as you can see in the lower picture, that means taking skin, like the picture on the very far left, we're taking skin that is in the upper part of the abdomen. And that brings in those sides. So it just contours and snatches you in from the sides and down to the bottom. You get a scar, can't get away from that. It is what it is. I personally think that that outweighs, or the contours outweigh the scar. Because it is a night and day difference if you don't do that. And the healing is not that much different, except that you do have a scar. For some patients, I think it's actually even a little bit easier because there's a little less pressure on that scar or the incision at the bottom when you are also taking it from the top. So from a tightness standpoint, it can actually be a little bit more comfortable. Okay.
I do have another question too, really quick.
Oh, yes. Go ahead.
Can you add other areas like hips and removal of excess skin on inner thighs at the same surgery, or would that need to be done separately?
Yeah, so excess from the hips, so liposuction, you can liposuction anywhere when you're doing this. I stay away personally. I don't think it's a great idea to do a BBL where you put fat transfer into the buttocks when you do a tummy tuck, just because you're sitting on your bottom all the time, and I feel that you have a lot more fat reabsorption. So I prefer not to do that. The inner thighs, so tummy tucks are it's a commitment in the beginning, for sure. Okay. You have to be bent over when you're walking. You want to put your energy into healing. Got a couple drains. And you add on top of that a thigh, which I think is also the next, in fact, even more significant for in terms of recovery. And putting those two together, while you can, it's not my favorite. I think that you are um, taking away from the recovering on one if you do them both together. But there's a caveat to that. Everyone's inner thigh lift is different. If you have just a little bit, then it's not as big of a deal. So I had a patient recently that I saw that had weight loss, and it was just right in, very at the top part of the thigh, the inner thigh, and the rest of the thigh was fairly decompressed, but didn't have a lot of skin, so wasn't going to have a lot of weight on it and pulling. And so for that patient, I think you could do those two together. But if it's a really large, heavy, lots of swelling, going to kind of restrict a lot of movement, then I think that splitting them up is a better idea, because then some of the risks of wound healing, and blood clot and such are decreased when you do that. So again, dependent on individual cases.
All right. I don't have any more questions
Okay.
right now from the panel.
Okay, great. So the next slide, it's got a little bit graphic on it, so sorry about that, but I think it's kind of fun to see. On the left, it shows you the belly button, okay? And it shows the outline of where we're anticipating that the muscles have split and you have softness, and that's what really contributes to that fullness of the belly. On the right is an actual, inside, once we lift up that skin and you see fat, we mark the sides of the belly button, and that's the area that we're pulling in. This is the area that has me say to patients, let's not do serious crunches for 6 months, because we want those stitches and the repair to be as solid as possible, because you want to keep that flat belly. So I hope that makes sense to everybody, because it's kind of hard if you're not a surgeon to like, what are you actually doing in there? But that's the region right underneath that flap that's there. Okay, so some before and after pictures. So this patient was a weight loss patient, and she, I want to say ideal, but really it is kind of ideal. So she had lost the weight in the midsection portion, and the thickness wasn't very much there. You can see on the very left upper portion that the contour of her abdomen is out, right? So it's kind of pushed out. And that on the lower picture, just below that, you can see that the contour of her abdomen is now pulled in, and she's getting more of that flat abdomen. The skin is gone. She does have stretch marks, as you can see, but those are then transferred down. and a lot of those were taken off. So I think that she has a great result with this. Similarly, this patient, she has a lot of stretch marks, a lot of hooding of the belly button. That's what we're looking for. We want to get that off, right? All that excess skin and such around the belly button. That's what we're targeting. When she sits down, I mean, you can just grab that. It can come off. I mean, that's what we're here for. You can see on the lower portion of the left picture that when we have this weight loss and we have the fullness and heaviness of the skin, it actually puts a lot of pressure on the pubic area. And it's kind of an extra benefit you get when you do this surgery is when you take off the skin, you're also pulling up on that area. So it tightens that area as well. And so you can see on her picture on the left, there seems to be some fullness there. And then on the right, it has smoothed out. She, for example, did not need that fleur-de-lis technique because we kept her incision kind of long. You can do that with her. And also because you can see above her belly button in that really upper portion of the abdomen, it's different than the lower, right? So it's not a lot, there's not a lot of softness there. So she could get a beautiful result by taking that fullness and letting it be displaced on the lower part and taking all that skin and fat off. Okay. This patient, again, fullness, taking off fat on the side. So she had a lot of liposuction on the sides and then had her excess on the bottom taken. One thing I just kind of want to show about this and in her scar, and it's still early on. A lot of these pictures, they're always still a little bit early on because patients are busy. But for the person, it's very important to be bent over after the surgery. And that's why it's really important to just make sure that your life can do that. Because if we put pressure on the scar, it can widen just because it's got that pulling sensation on both sides of the incision. Some people just naturally will pigment. And there's nothing you can do about that, or naturally because of stretch marks will have a tendency to get a wider scar. The great thing about doing your surgery at Westlake Dermatology is that we have zillions of lasers who can target all of these problems. So that's been a real wonderful thing I've loved about working here is just being able to help patients in multiple ways and from multiple angles.
I do have another question that was a little bit relevant to that. Um,
Okay.
a patient asks, while a return to youthful levels of skin suppleness and elasticity is not reasonable to expect, although I have opinions on that, if left alone, perhaps even supplemented with collagen peptides, how much bounce back could be expected naturally if the patient was over 50? In other words, if I waited longer to get the surgery, would that reduce the amount of work required?
If you're waiting longer will it reduce the amount
I
of
think what
work?
I think what is being asking, this is, I believe, the same patient that's down to like a 10%
I
body
see.
fat. So
Yeah.
like I'm thinking likely I've had a tummy tuck, so I can chime in on this, and I didn't have mine until I was 44. Now,
Yeah.
as someone who just naturally had a lot of stretch marks, it's not going to cure stretch marks, but
Right.
the suppleness is restored because you're like excising that skin, and it does restore the tightness in a way that exercise crunches, creams, supplements can't. um and I don't know if it matters if you're over 50 or if you wait longer. When it's loose skin, it simply just kind of needs to be removed, don't you think, Dr. B?
Yes, I do think we are continually losing collagen and continuing to age, regardless of what supplements we take. I do think that surgery works better. Um, Outcomes are better. Skin bounces back better when people do things at a younger age. I find that definitely in facelifts. I think that facelifts by far have such a beautiful result when they're done in that 50-year-old time for the first one. So with an abdominoplasty, it's really just the quality of your skin at the time. I would think, with age, that quality does unfortunately go down. So for me, if you're at the place where it's time, you're a candidate, waiting longer is not going to make you a better candidate unless it's more of a medical issue or a lifestyle issue, like you travel every weekend, that kind of thing, but not from a skin standpoint. No. Does that answer?
Yes.
Okay.
And we're caught up for now.
Okay, good. All right. So this patient, she's kind of more, I think, a typical patient, hasn't really had a lot of weight loss, but she's got that fullness, right? She's got that post-child um, hormonal accumulation in the center, fullness of the stretch of the muscle, so it makes her belly push out. And then she's got that phenomenon, right? Like I mentioned, you can see on the upper portion of the pictures in her pubic area, where in a swimsuit, you're going to see that fullness there. And with a tummy tuck, you get the abdomen, and then you also get that added extra where it's pulling up on the pubic area and it doesn't have that fold anymore. So I think that's benefit. So for this patient, liposuction everywhere. Okay. And then traditional lower scar around the belly button, and skin removal. I mean, I think, that silhouette, that curvature, I think that really makes her youthful. Took 10 years off, in my opinion. Right. Um, This is an excellent patient to bring up because she has a midline scar. This does happen, obviously, with some patients, whether or not they had an emergency C-section, they've had some other health issues in life. And well, if it's below the belly button and you have enough laxity there, then that can be removed. It is a little bit more of a tricky dissection. And so I would say that I would choose to schedule your surgery for a little bit longer because we want to make sure that we're not going to encounter any hernias and such. But you can see with her that again, in her pubic area, that's completely different. It's thinned out, it's pulled up, her scar is gone. She does have a very she has a lengthy scar, but that's because that's what she needed in order to redistribute the fullness that's sort of around that belly button area so that she didn't have to have the vertical scar. So sometimes, I'm balancing, you have a little fullness on the top, we make the scar a little bit longer on the bottom, we can take out that fullness and you can get a beautiful look. Other times, what you'll see in some patients, we can't get around that. But so she's a great one where she really could just make a whole new look for herself.
Oh, that one looks great.
This is an example of someone who you have to take all of the skin and such from the upper portion. So this is a fleur-de-lis type of abdominoplasty. The incision goes from up the top of the abdomen down to the belly button, then down to your traditional incision. And if you had just done the bottom portion only, just the traditional tummy tuck, you would have all that fullness that you see on the upper portion on the bottom, and she would not look anything like she does on the right. So for her, we had a lot of liposuction on the sides, kind of more towards the flanks to really, and then bringing it up, over just underneath the breast and pulling all that skin in, taking it off the bottom. Again, this is totally, completely changing her pubic area. I think she has a beautiful result.
Amazing. I do have another question.
Yeah.
It's a great question, actually.
Okay.
The patient states, I am 63 and have thought about this numerous times, but financially was unable. Should I even consider this at my age?
First question, are you healthy? Mobility's fine. Do you have some help at home for recovery? Because you do need friends. For this surgery, you need some friends. And if you don't have some help at home necessarily, like do you have the resources to get someone to help you? So those kind of things are out there. Otherwise, at that age, absolutely, absolutely you can. And we do it all the time. I think sometimes if we're getting towards 80, it's a little bit, so we're dealing with more with medical problems and mobility. But at 63, you're young. I think you're young. So I'm in my 50s, mid 50s. So 63 seems very young. Any other?
No, we're caught up.
Okay.
Oh, actually, here, I have one
Yes.
that just popped up.
Okay. Yes.
I am 37, lost 80 pounds, and at my goal weight. I didn't realize
Great.
I'd hit it because my stomach looks a lot like this person. If we
Okay.
come see you in the office, will you be able to tell us if we're a candidate for this? Yes.
Oh yeah,
Yes, yes.
absolutely. Um, sometimes I always tell patients they come in and plastic surgery is a very tactile examination. So when you come in, it's not just pictures. Sometimes you can't even tell. We just feel the thickness, see where things are going to be moving. And so that's what we'll be doing is seeing where, if we push here, if we pull here, if we redistribute things, how is that going to look? And is that going to get you where you have a beautiful look and where you want to be? So yeah, absolutely. I could tell you that. Yes.
So can I.
Yes. And so can
Yes,
Letty. Yes. She's
so can I.
tons of these. And it's also been wonderful because she's been through it. I
I
have not had a tummy tuck personally. So she has a completely different perspective on things
absolutely.
and can add some things in that I can't for that.
And then just so the patients know, I'm also able to give you a complete pricing breakdown of what your procedure would consist of, and including your anesthesia, your follow-up visits, everything like that. So even Dr. Bekanich's schedule can be a little bit fuller, and I believe that you're gonna after the webinar you will receive a link to get in contact with me, so you can send me some questions. You could shoot me an email, but I can answer a lot of questions, and also provide you with pricing once we have our consultation and I'm able to kind of get in and take a quick look.
Yes, exactly. Okay, and thank you, Letty. We
Of
always
course.
appreciate that.
Yes, yes.
And if Letty has questions about something you guys have discussed, she just reaches out to us and directly in our lovely mobile age of communication. So that makes a very streamlined process as well.
Yes.
Okay. Next patient, again, she had a lot of just the way her babies were. They pushed out on her belly. Everybody's different, right? A lot of in that hip portion. Um, and we were able to do the liposuction on the sides and take off all that skin. She's still in the healing process. Her belly button area is still red. Um, but really just kind of makes it nice and smooth. This is another example of someone who's full, right? I mean, she's pretty full, but with a combination of the liposuction and the abdominoplasty, again, you might look at her picture and say, well, gee, I think wouldn't she need that incision that goes all the way up and down? But it's my examination talking physical examination that determines that. And I think she has a beautiful result, did not need to have the incision all the way down. Um, and then for her, it's a little atypical with her skin type to have a little darkening of the incision. But again, with lasers and things, we work on that as we go, if that does happen to you. But beautiful result. I mean, I think she looks totally different, right? Totally different person.
Absolutely. I have two more questions.
Sure.
Okay, patient is asking, I had an umbilical hernia repair done 2 years ago. I had a patch placed under the skin to correct it. Can you tell me a little bit about how a tummy tuck works with the patch for the repair?
Yeah. So the most likely thing is that mesh is inside and not just under the skin. So when you have a hernia, once, the layers of your belly wall have been stretched so that the bottom parts are coming up through. What they're trying to do when they're putting in the mesh or the patch is to go in and bring those back in and put it underneath where the hole is. So this is the outside of you. And so when I'm working on it, I'm just coming through and I'm not even seeing that. I don't like to do a surgery when you've just had it done, but typically that's not anything I wouldn't expect to see the patch. I would, but of course, we're going to talk about the fact that you've had a hernia, um, and look and see if there's any recurrence there. Although I think the patches have been really great. Recurrences are much lower now. Some patients have had just a stitch put in instead of the actual mesh placement for reconstruction. Those have more of a tendency to recur and recur fairly frequently. But with your mesh, hopefully you don't have a recurrence, and it's not anything that I have to move or maneuver around because it's inside.
All right, I have one more. Um, how has the tummy tuck changed over time? How might a patient's experience results recovery from getting one today compared to someone who had one, say, 20 years ago?
Yes. So, our incisions are lower, partially because the C-section scars are more frequent now. So that's changed. I think it makes the dissection a little bit different, be a little bit more tricky when you're in that area. It's changed in the sense that we do a lot more liposuction when we do an abdominoplasty through studies and experience of all of these pioneers and big figures in our specialty. Slowly we have been able to integrate liposuction with a tummy tuck instead and doing it safely so that the healing process is favorable, um, compared to just saying, nope, sorry, you're not a candidate. You have to go do blah, 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 blah before I'll even see you. Um, that's really changed. I think that's a big thing. And a part of that has to do with the way liposuction is performed, um, and being with an experienced surgeon who knows what level of fat to stay in so that it doesn't become compromised. That's very important. That's changed. Also, we do something called progressive suture, and that's complicated, but it means that what we're doing inside is helping and such that we're heal faster, attach, close space. The important thing to you as the patient is that the drain gets removed sooner and also take some of the tension off of the scar. So that's another great thing that has happened. Residency, I think those drains were very uncomfortable. Drains that we use are much more comfortable. And then the compression garments, those have really evolved. But in terms of just like the technical, those are the things I think that have changed more. The incisions, again, are lower, just more variability, more physicians tailoring it to patients rather than just sticking to a cookie cutter.
We're caught up on questions, so
Right.
yes, we're great.
Okay. All right. Next one. Again, another person who really needed to have that taken on in the upper portion. She has beautiful results. It just changes from the square where you actually get a little silhouette. And for her, again, all these pictures are they're a little bit early on. Patients' lives are busy, life's busy. No one, it's difficult to get patients back, years later to show how well a scar will heal. But on her, with that bit of redness, that will completely resolve. And so she'll have a scar. Always, anytime we do anything, there's a scar there, but it will fade with time, and she's gonna look beautiful in her clothes. Makes a
I feel
huge
like
impact.
I was just gonna say, I feel like I noticed that with mine, the improvement was after the 1 year mark. After the 1 year
Yes.
mark, that scar just gets lighter and lighter and
Mhm.
lighter. So yeah, like you can't even see mine anymore. It's great.
Yes, I agree. Okay. Another example of a patient who, everyone's different, right? Like all these pictures are so different. Everyone keeps their fullness or their fat in different. She needed liposuction clearly on the sides, taking all that fat away, bringing in that waist. She had a tendency to hyperpigment, so when you start to see this, we immediately put you on hydroquinone and get pretty aggressive with it because just some patients do hyperpigment, and usually that's something you kind of know ahead of time because you've had a little scratch or something done in your life beforehand. Um, but in terms of, took off a lot of those stretch marks. She still does have some stretch marks there. If they are around the belly button area and above the belly button, they're just going to get transferred down to the bottom, but that's okay, right? Life is life. We have what we have, and you can still get a really beautiful result. Okay. Another patient, very deflated, right? Very deflated, all centered, had to bring out her scar a little bit wide in order to redistribute that crinkling part of the skin that's up at the top. So you don't want someone like her, you don't want that part that goes down. If you can just make the scar go out a little bit longer on the outer portion. For me, that's a trade-off. I think it's worth it, rather than having the midline scar. And then she just gets that really beautiful, beautiful silhouette that really makes her have more of a youthful look, in my opinion. Okay. And then this patient, I like this one to include because yet again, everybody's different. But she's kind of got that the tiered look of her abdomen. And this is where experienced liposuction when you're doing this makes all the difference. So she's getting a traditional abdominoplasty, but the fullness that really contributes to her beautiful contours at the end are by doing very precise focal liposuction coming in from the sides and such to thin those out so that she can get that flat belly. And so that's why I wanted to include her. Again, someone talked about recovery. So generally 6 weeks is what we say. Ideally, 2 weeks off of work. That's for tummy tuck. I would probably want that. So because you're dealing with the drains, it's kind of awkward to have drains when you're wandering around. You've got sometimes sometimes the stitches are on the inside. That depends on your skin and how I think it's best going to heal. If you have stitches around the belly button, those are going to come out about 2 weeks. I put steri strips, like tape across the incision. I think that just heals better. We'll take that tape off at the 2 week mark. Sometimes at the 1 week mark, you wear a binder, compression binder to number one, give you support. It decreases pain because things aren't jiggling. Also helps to do with contour and shaping. Also helps to reduce the amount of fluid collection you have, and we get those drains out sooner. Bent at the waist, I've mentioned that before, and it's important. I know it's annoying. Your lower back starts to hurt because you're bent over. So I have different suggestions on how to relieve that. Anyone who's been pregnant knows that kind of sitting on your back in that position can hurt on your tailbone pretty quickly. So we talk about using pillows and such. But it's an important part of the surgery to keep your scar nice and smooth.
Dr. B, how
Um,
long do you keep how long do you keep the drains in?
so it depends on the patient, but on average, the first one comes out the first week, the second comes out the second week. You have a little log, and we teach you how to take care of the drains because we don't want them to get clogged. And in the log, you put the amount that's coming out of each drain, and the drain tells us when it's ready to come out. We are looking at a 24-hour period of time. So we take it out when it meets a certain criteria. Yeah. I put avoiding exercise that's variable. The first 2 weeks, obviously. If it's winter and you're having the surgery, then once you're starting to kind of stretch your belly and it's nice and cool outside, and you can kind of go outside and walk a little bit, not around the block because that's too much. Just try that first. Then you can start doing that. But really, we're not exercising until getting into that 1 month, 6 week, and definitely not doing crunches. But again, it's tailored to how your skin is healing. I see you typically almost every week, depending upon your recovery. And I give recommendations then on what I think the next steps are. Increasing protein. The minute you start thinking about surgery, increase your protein. It helps with all healing, taking yourself in the best position possible, health-wise, so that you heal well. And protein's a big part of that, especially if we've been on weight loss drugs. We do, talking about weight loss, talking about the weight loss medications, we have you go off of those a month ahead of time for various reasons. One of them, though, is protein and making sure you're getting good caloric, nutritional intake. And then we wait for 2 weeks afterwards as well. So that's kind of something important to mention in today's world. Healing faster. Again, setting yourself for success. Don't have a wedding to go to. Don't have your most important vacation that's for your birthday a month after surgery. Okay. I'm through those questions because I want us all to have a good experience. I want you to be happy to have a good experience. Increasing your protein, taking multivitamin, lymphatic drainage, massage. People love it. We have recommendations for patient, where we can send you. It can help reduce the swelling, which makes you feel a lot better sooner, because really any surgery you have swelling pretty much head to toe, not just in the area that you're working. And those therapists are excellent at getting some of that fluid off. That helps the skin kind of tighten and you get the contours faster. Wearing your compression, that gets you to where you want to be faster, getting out the drains because those spaces are closed for where the fluid can collect. And listen to your body. So once I start saying you can do things, you can go to work, you can exercise, the caveat that I say is if you're at the end of the day, you're super swollen, then you say, okay, I need to decrease that just a little bit. Need to modify it a little bit. Bring it back. Your body is telling you something. Okay. Arnica pills, they're homeopathic. Some patients really think that they help them with swelling and recovery and bruising if you happen to have any. So we recommend those as well. Hydration, hydration, hydration. To get some of that fluid off, stay healthy. Water is our friend. Okay, so the next steps, I think we've kind of discussed this. You can follow me on Instagram, although I'm not the best person with posting. I'm trying to get better with that. But I do have an Instagram page. Ms. Letty is my cosmetic consultant. And again, she'll contact you by email, like she'll talk about. I do see patients all over the area. So certain days, Georgetown, I'm here on Thursdays, and Lamar Central by Central Market on Fridays, and Domain Northside on Wednesdays. So I go the whole breadth of the area. When we have our do my surgery at Westlake Hill Surgery Center or Lamar Central. And then I do see you the next day, and that's usually at Lamar Central. And then after that, you can go back to your preferred location. Okay.
All
That's
right.
me. That's tummy tucks. Is that Shan?
Yes, yes. Thank
Any
you,
other
Dr.
questions?
B, for your time. We do have a question if insurance covers any of this, and unfortunately, we don't take insurance for cosmetic cases. Typically, yeah, the type of procedure where it's called a paniculectomy, where they just focus on that lower flap of skin, isn't the same as a complete tummy tuck. It doesn't bring the muscle wall in. And it's not going to be as detailed of a surgery as what Dr. Bekanich performs. Do you have any additional on that?
Yeah, for insurance, they're looking for if you're having medical issues related to that. So that's something to work with, if you think you're a person in that circumstance, you want to work with your primary care physician. And I know they can probably guide you, but if you're having a lot of sores, that, or fungal infections, some real severe medical problems, then sometimes, and it's large enough that, insurance companies have these giant criterias for things. I used to have to do peer review things for them, and they're pretty rigid, but if you can fall into that category, it's possible. It will just take off that lower part and there'll be a step off there. The surgeons are great. They're doing what they're supposed to do, be very relieving for those symptoms. So it depends on what you're looking for.
Fabulous. All right, I think that's it for questions. If you don't have anything else, please keep your eye open for that